Okay, so welcome again to our Crafting Support Project webinar. Today we have our webinar on healthy boundaries and empowering independence. And for those of you who haven't met me before, I'm Julie McCarthy. I'm a clinical psychologist at McLean Hospital, and I'll be leading our webinar presentation today, and I'm excited to introduce you later on to some of our panelists as well. So our agenda for today is first going over a bit about what the Crafting Support Project is, and then we'll kind of dive into our main topics for today in terms of thinking about healthy boundaries and empowering independence, and along those lines, also thinking about how allowing for natural consequences plays into those ideas. And then I'm very excited for the last half of our presentation tonight, and we go from about 5 to 6:30. We'll have a Q&A with a clinician panel with panelists from across different programs at our hospital to share their insights on this topic as well. And before we start with the background information, I'd love to get a quick sense of who's joining us today. So I'm going to launch a poll in the Zoom presentation. And so if you can see this, I'd love for you to share what best describes your role in terms of being an audience member in this webinar. So sometimes we have family members, people who have their own lived experience with mental health challenges, clinicians, or none of the above, or sometimes you may have an overlap of some of these identities as well. So feel free to share your role if you feel comfortable in the chat, and then we'll get a sense when we share with everyone about who's with us tonight. Okay, folks, one more minute. Okay, so it looks like we have primarily family members here tonight. Thank you so much for joining us. This is definitely geared toward family members, and then also anyone who's really interested in learning more about some of the skills that we talk about today or throughout the series, and then also people who might be interested in learning more about this as a resource for themselves, their loved ones, or potentially clients that they work with as well. So thank you so much. Okay, so to get started in terms of talking about why we're all here, chances are if you are joining us tonight, you have currently, or maybe sometime in the past, have had a loved one who, for whatever reason, may have needed some additional help, certainly regarding mental health or working on recovery in some regard. And it's tricky, when we've got a loved one who might need help and they may or may not see that need for help in the same way themselves. And so, we've talked in our last session on how to talk about treatment, different levels of care, where sometimes people really need to be seen in a hospital, for instance, but more often than not, we might have loved ones who don't quite rise to that level of needing inpatient hospitalization, for instance, and they may or may not be getting care on an outpatient basis. And so then we as family members might be in a situation where we're kind of in limbo. We don't exactly know what to do. We want to help, but we may not be entirely sure how to do that. And sometimes what can happen when we're not sure is we may feel like we're walking on eggshells, not knowing exactly what to do or say, which can sometimes lead us to feel like we're doing nothing. Or, we are trying things, but for whatever reason, it might feel like it's still a tense or stressful situation. And so sometimes it can lead us to feel somewhat powerless in terms of knowing what to do. And I've, certainly been in that position myself, having loved ones who have experienced their own mental health challenges in recovery too. And so I think I'm really excited to have you all with us today because this is a chance to talk about some evidence-based approaches that can really help any of us, not only help a loved one perhaps engage in treatment or think about how to navigate that recovery process, but also to think about how we can take care of ourselves throughout that journey. And so what I'll be talking about is, certainly relevant to today's topic in terms of how we can offer help to our loved ones in different ways that really make sense, not only for them, but for ourselves too. And the main approach that we talk about throughout the webinar is something called CRAFT, or Community Reinforcement and Family Training. So this isn't something that I just made up. This has actually been around for quite a while and was developed originally for people with substance use disorders. And the idea originally was to help a loved one, get into treatment who never wanted to go near treatment at all, or for those who were in treatment or in and out of treatment to support a loved one throughout their recovery. And what research has shown is that 7 out of 10 family members or people who have a loved one who may have needed treatment were able to actually help get that loved one in the door, which is huge. And what people found for themselves was that their own depression and anxiety decreased and their happiness increased, not only for themselves, but with their loved one too. And since the 90s when this was created, it's been adapted and disseminated throughout the country and internationally, yet it's still often the case that people are maybe learning about CRAFT perhaps for the first time. And so it's never too late to learn, and this is another chance to kind of learn a bit more. And what I mean by CRAFT and some of these skills that people have found helpful really include many of the topics that we talk about in this webinar, but things like building motivation for oneself as a family member or concerned significant other per se, because oftentimes those are the folks that we're meeting with in this type of webinar or in CRAFT sessions, and also thinking about how to approach self-care and goal setting appropriate goals for ourselves, but also thinking about how we can do that with our loved ones too. And then one of the key components of CRAFT is really communication. People find it one of the most useful topics that we discuss, largely because people can see immediate results now, and then it can really apply to so many situations with our loved ones, coworkers, whoever it might be. And then we talk about functional analysis too, kind of trying to build empathy and understanding for what our loved ones might be going through. And we have recently, a couple of sessions ago, talked about this idea of positive reinforcement, catching and rewarding healthy behaviors, allowing for natural consequences, which we'll be touching on today, inviting the loved one into treatment, which we covered last time, and then problem solving, which will be coming up next. So where we've gone from this from a research standpoint at our own hospital is actually kind of looking at how CRAFT might be helpful for families experiencing early psychosis and substance use. So why did I try to put together a project on this? Well, one, because we know that when substance use is on board with someone who's experiencing psychosis, this can be pretty common, up to 50% of folks might have a lifetime experience with this. And then also, this substance use can predict poor treatment outcomes and poor treatment engagement, including early dropout. And despite the fact that we have a number of programs or treatments that can really be helpful in improving quality of life and addressing certain symptoms, moving the needle on substance use really does unfortunately remain an unmet need. And so we can start to think about, well, how can we increase readiness to change as a treatment target, even among those who may already be engaged in care? And in thinking about why CRAFT would be a great candidate intervention for something like this, well, it's an intervention that really loops in family members who are a key resource in the recovery process. And lots of people with early psychosis, and by early psychosis, I mean kind of earlier on in their recovery journey, still live with family. Families often may have some contact with the clinic, but it kind of depends on a release of information. Many people who develop psychosis do so in late adolescence or often early adulthood. So they often do have the ability to decide who's involved in their care. And so it can be tricky sometimes when family members want to be involved, but they may or may not actually have free ability to do so. And then also, we've talked to some folks and there's some research to suggest that clients may feel sometimes more comfortable talking to a third party like a treatment provider versus the family themselves. And yet, especially if they are still living with family members, it makes sense that they might want to be involved because they're living and interacting with that person on a day-to-day. And so sometimes in the absence of information or their perceived ability to kind of know what's going on in treatment or feel like they're contributing in a helpful way, it can really cause some distress, which can be both a predictor of, symptom exacerbation for people, and then also additional substance use. So it can create kind of an difficult cycle for folks. And so in thinking about how to test out craft for early psychosis and substance use, even before the pandemic, we were planning on doing a telehealth study on this, where we would provide coaching to folks on Zoom to minimize burdens of transportation and kind of logistics of time. And we originally piloted this in several families, over 6 to 8 sessions or so, conducted focus groups to get feedback, and then tested this out with another set of 10 families and refined the feedback with further focus groups. And we were working with primarily mothers of people with adult children with early psychosis and some substance use in the form of alcohol, cannabis, a combination of those or additional substances. And interestingly, the majority of folks, 75%, actually met criteria for their own DSM diagnosis, which means a mental health diagnosis either currently or in the past, which really suggests that family members themselves have their own demonstrated need for support. And 80% endorsed some history of trauma themselves. And so this wasn't necessarily meant to be individual therapy in a long-term sense, but really something that could complement existing support that they may have been getting elsewhere too. And what we found so far was that, by families completing this type of coaching, their happiness with their loved one really increased, in addition to improving their own depression and anxiety, just as CRAFT has done for families with substance use alone. And in terms of some of the feedback, families had said, it made me reassess how I say things. I didn't really think about that before. Sometimes we get into autopilot, sometimes we're kind of the status quo, and it can feel hard to change that. And so this gives people a chance to step back and really think about what makes sense to talk about now. Another family member said, we all have had this experience when we do it kind of wrong in their eyes or, our loved one's eyes. And that usually creates a blow up. And I think role playing helps us get comfortable so that we can try these things in a way that will be productive. So we really practice kind of what to say. And we'll talk a little bit about what to say with respect to healthy boundaries and empowering independence today too. Other folks said, less is more. I learned that. And I think really that was probably the most important thing I took away. And here I think this is relevant to our topic for tonight in thinking about that offering love and support to people we care about can look like a lot of different things. And it doesn't always have to mean more is more. And last but not least, a parent said, I wanted to learn more about what is effective, what does work, how to look at it differently, especially how to communicate without using threats or ultimatums or just negative thinking. I was hoping to learn how to communicate all of that better, and I feel like I did. And so we're now looking at this intervention compared to treatment as usual to see if it offers anything above and beyond existing supports. And so if folks are interested who haven't already been in our research study, we're still recruiting family members who could have a chance to either get the intervention or treatment as usual, and both are really important so that we can try to make a case for offering additional supports to families down the road, should it be helpful. And we're also looking for the client perspective too, to think about, well, how is this helpful for the people that we're aiming to serve, our loved ones with early psychosis and substance use for this research project in particular. And so they are welcome to join. They don't necessarily do the coaching sessions per se, but we do track their progress over time and try to understand their needs. And so we realize, though, that not everyone's eligible for the research study, but they still want support. Or some people, maybe looking for additional guidance and they may not think that research is for them. And so that's what's led actually to this crafting support project. And so we offer 2 sets of services. One is the monthly webinar series that you're attending tonight, where we can really offer some of these skills to a wider audience. And then we are also offering some one-on-one coaching as well. So the webinars, we're about halfway through our programming for this year, and we have several additional sessions coming up. Most of them are based in the craft skills, but some also include things like WRAP or the Wellness Recovery Action Plan that will be led by one of our peer specialists. And then the one-on-one coaching currently has a waitlist at the moment. However, we are open right now to McLean families who have loved ones with psychosis and have had some history with McLean services. And this is really geared toward people who may not be eligible for the research study or when available for those who were unable to get the intervention through the research. So if anyone has questions, feel free to get in touch. And in terms of the big picture, we've talked about research, we've talked about how this has led to greater educational services, and then we're also trying to assess whether or not, this might be an appropriate set of skills to offer through clinical services as well. So now I'm going to turn our attention to this idea of healthy boundaries and empowering independence more specifically. All right, so this idea of being independent sounds all well and good, but what do we mean by that? So according to the Oxford Dictionary, people say that being independent means being free from outside control or not depending on another's authority. Alternatively, or along that line, thinking about not depending on another for livelihood or subsistence. And so I think, people have different views on what independence might mean. Certainly different societies may, champion this idea of being independent more than others. And so to some degree or another, lots of us like the idea of being able to do some things for ourselves, perhaps. And also, I think being independent also may involve knowing when it makes sense to ask for help too. None of us live in a bubble per se, but for yourselves, I'd like you to think about for a moment, what does independent mean when you think about wanting to encourage or empower that for your loved one? So if you feel comfortable, feel free to put some of your ideas in the chat so that we can kind of get a sense of, taking stock for yourself, but also thinking about what independence means for this community as well. There are no right or wrong answers here. So sometimes for people, being independent might mean being able to make it to appointments by themselves, or it might be getting themselves up on time, or perhaps applying for that job or volunteering. It could be all types of different things. So one of our attendees said that returning to college is what independence looks like for their loved one. Another person shared, having a job, thinking about how that might set someone up for independence in the long run. And similarly, that goes along with this idea of being financially secure. Others are saying being able to maintain part-time work, manage money independently, maintaining med schedule. So thinking about different aspects of one's life. Another is saying also kind of getting a job, but also getting out of the house. A lot of people that we work with, certainly for the research study and the crafting support project as well, might be at a time when it is a natural transition to think about how people are moving from, traditional child-parent relationships where you are supposed to be completely responsible, for, a loved one perhaps, and then also thinking about where developmentally it's naturally to allow or encourage more independence, whether or not there are mental health concerns on board. Other folks are talking about eventually, maybe not necessarily today, having one's own place or not living at home, being able to return to work, perhaps for someone who's already had experience with some level of work or independence in the past. Ooh, we've got some other great ideas too, making their own decisions. So whatever that might be, but kind of having that autonomy there. For other people, it might be not just getting a job, but keeping a job and a full-time job, or taking care of oneself. And that can mean a lot of different things. And I like how that also leaves that open to interpretation for what that means to your loved one too. Another person says, following through with things like appointments, planning for the future, becoming self-sufficient. And another person shared, feeling self-assurance, right? Some level of confidence that we're not only able to do it, but we feel like we're able to do those things, or a loved one feels confident in their own abilities. Thank you so much for sharing all of those great ideas and perspectives. And so the reason why I'm asking you all this is to really think about, well, when we think about, okay, what we want for our loved ones, really trying to take a moment to define that, for ourselves and for our loved ones to really share what that means with us, perhaps, that allows us to kind of think about, well, how do we get from point A to point B? And so one of the ways we can think about that is, well, how do we empower our loved ones toward that goal of becoming more independent? And so in terms of what we mean by empower, this means giving someone or our loved one the authority or power to do something, or making someone or a loved one stronger and more confident, especially in controlling their life and claiming their rights. And I think this really speaks to some of the comments that were popping up in the chat about kind of being in charge of their, one's own decisions, perhaps, feeling that self-assurance or confidence, and thinking about what it means to have agency or somewhat of control of one's own life or how they're living it. So really trying to think about where might we have served some of the roles of kind of taking responsibility for different aspects of our loved one's life, and thinking about how can we help empower our loved ones to take on, maybe not all at once, but over time, more of those responsibilities that chances are they want for themselves, and that we would like to maybe have a break from as well. All right. However, we're also talking about healthy boundaries. And so when we're thinking about changing roles, sometimes those boundaries are not always so clear. So for ourselves, we can think about, well, what does that mean? And how might that look for my family? So a boundary is really this line that marks the limits of an area, a dividing line or limit of a subject or sphere of activity. So we'll talk a little bit more about this later. And so it's in no way saying like we can't provide support to our loved one, or we can't help them out, or they have to do everything on their own. We're just talking about times when it makes sense to think about what we are willing and capable to offer, and what might be more in our loved one's court. So sometimes, whether it be, ourselves and a spouse or a significant other, or ourselves or our children, kind of dividing and conquering sometimes about who's responsible for what, can allow us to all be on the same page a little bit more about, how are things going to play out? And in some ways can actually free everyone up in the process to have a bit more time and a bit more energy to do the things that we want to be doing. Okay, and so we'll talk in just a moment about how we create those healthy boundaries. And before we go into that, I'd like to bring your attention back to the chat for a moment and think about, what is an example of a healthy boundary that you've already experienced or that you currently already have in place with someone in your life? That could be in your personal life, like in your family. It could be with friends. It could be with colleagues or clients that you work with. But what are some examples of things that you already think of as healthy boundaries? Because just because we have topics on different areas like healthy boundaries or communication doesn't mean that you all already don't know how to do some of this already well. We just talk about some of these topics to think about how to expand our skills in the areas that are a bit more challenging, perhaps, to do so. So we're looking for examples of healthy boundaries so far. Okay, so one of the examples is can't use the car in the middle of the night. Fair. Sometimes boundaries might be around certain types of activities or certain times in a day. Okay, another person said, told the sister that she can't call at night because can't offer support then. That's completely fair, right? So even if we're thinking about what we'd like to be able to provide, if we're not in a position to provide that support, it makes sense to kind of communicate that to others too. So another person said, one healthy boundary that they have is that their son must have a psychiatrist and therapist with whom, that person works with regularly. For other people, it might be like, okay, one of my healthy boundaries might be, I'm not going to check my email or my phone after a certain time, and maybe I'll let people know that, so that they can be aware of my boundaries there, or not. But that's something that you could set in your, for yourself, because that's something that you are in control of. Another person said, not having pot in the house, let's say, or in the car. And there could be alternative places where people store that type of substance, let's say, but it's not going to be in your house per se or in your vehicle. So these are all great examples. All right, so now we're going to talk a little bit more about, well, how can we develop some of these healthy boundaries if we feel like there's some room for improvement for ourselves, or if we feel like it's been kind of tough to establish those in the past. So one of the ways to think about doing that is how we can think about this idea of allowing for natural consequences, in doing so, really helping to establish some of those healthy boundaries for ourselves. Okay, so what are natural consequences? So some of these things are, things that essentially are the outcomes of decisions that our loved ones might make for themselves. And so these might be results of things like choosing to use substances, or it might be things like choosing to avoid engaging in school or work, let's say, or putting something off. So some of the natural consequences of those types of decisions or behaviors might be feeling hungover, for instance, being really tired, ending up being late to work, getting a low grade in school, if they're late on assignments or things like that. If they're spending money on things that you'd rather not have your loved ones spend money on, they may run out of money and, might be looking for additional financial support. For other people, it might have been, hey, they crashed a car, let's say, or they don't have the funds to support a car, so they don't have transportation. Sometimes if there have been moments where there's been a conflict around, being able to meet certain responsibilities, or things were said or done at a time when a loved one was intoxicated, they may have strained relationships with family or friends. There can also be legal issues that are certainly natural consequences, especially if it involves, breaking the law in terms of driving, or involvement with other people. And then sometimes housing issues as well, especially, if folks have not been able to meet the expectations for certain housing arrangements, whether that be at home or at college or in a group home or something like that. And so we can start to think about, the fact that these consequences certainly exist. And we as family members, sometimes want to step in and save our loved ones or protect them in some ways from experiencing those natural consequences. Why? Because we care about them. And we want to do everything that we can to help them. And so sometimes we might help our loved one avoid or cope with some of the natural consequences because, we just want to make it a little bit easier for them. However, this can unintentionally make it easier for them also in their mind to kind of continue doing the unhealthy behavior that may have led to this consequence or series of consequences in the first place. And it can ultimately make it a little bit harder for our loved ones to end up reaching their goals. And so instead, we can think about, well, how can we remove ourselves, as that buffer to allow our loved ones to safely experience some of these natural consequences, so that, if they're going to make decisions about what they're doing anyway, whether it be around substance use or about choices with friends or schoolwork or employment, that they have the freedom to make them anyway. And we're allowing them to have that as a learning experience in some sense, and to experience the natural consequences of their own behavior. And everyone's personal boundaries or limits in terms of where they would want to step in to help their loved one is different. So at the very least, we always kind of want to check in with ourselves about, is this a natural consequence that is safe to allow for my loved one? Because at the end of the day, we want to make sure that our loved one isn't in a life or death situation or anything like that. So we want to think about which natural consequences you would personally feel like would be reasonable and comfortable for you to allow. And so what happens is, when we allow our loved ones to experience natural consequences, it's different than punishment because it's not as though we're trying to, you know, add anything to the situation that maybe wasn't already discussed, or we didn't necessarily create laws designed to inconvenience our loved ones. We're allowing them to experience things that serve ultimately to decrease the likelihood of them repeating the unhealthy behaviors. And then on the flip side, we're also able to, instead of feeling like we're just doing nothing or sitting on our hands, we're also able to positively reinforce, as we've talked about in a prior webinar, the healthy behaviors that we would like to see our loved ones doing, which ultimately, when we use rewards to pair with the healthy behaviors that we see, it serves to increase the likelihood of those healthy behaviors increasing. And so ultimately, by both allowing for natural consequences and including positive reinforcement in how we work with our loved ones, we're able to provide support in different ways. And ultimately, this can be an effective way to think about, which boundaries make sense and where we do feel comfortable offering support. And so, sometimes we might think, especially with, our loved ones, if they just did or said what we asked them to do or what we thought would be best, we wouldn't have any problems. And, at the same time, we can't live our loved ones' lives for them. And chances are we probably wouldn't want that. We've got our own lives to live. And, if we're in our loved ones' shoes, like we probably wouldn't want to be told what to do all the time either. So instead, we can start to think about, shifting the sphere of influence and thinking about, well, what is under our control? Because if we were able to, stop our loved ones from using substances or making sure they took their medication every day, all day for the rest of their lives, we would have already done it and we wouldn't have this topic. And so we know that there are certain things that really are up to our loved ones and certain things that are within our sphere of control. And so shifting control where it makes sense to our loved ones can really empower them to make their own decision, strengthen their resilience and independence. And then it also frees you up to feel like you are able to provide support that you have the ability to do. And then also thinking about the fact that, we're creating a bit of a boundary, it also makes sure that you feel like you're keeping, quote, your side of the street clean in some ways, in terms of feeling that you're not compromising any of your values in the process. So I'd like you to think for a moment about, some forms of unintentional support that we might find ourselves offering or maybe have offered in the past. So thinking about unintentional support that may have, in some ways sent the message to our loved one that, okay, maybe it's not so bad, to experience these consequences, or, we're buffering how intense those consequences might be. Sometimes this can come in the form of making excuses. So for instance, if a loved one's late to work and the boss is calling, like, where is the loved one? If you pick up the phone and say, oh, they're just feeling a little under the weather, sorry about that. Making an excuse for them, kind of lets our loved ones off the hook a little bit for needing to navigate some of those situations themselves. For other people, it might be providing financial support. Maybe you've already set a certain amount that you'd like to offer your loved one, and they might be asking for more, and you give it, and you find out maybe later that, oh gosh, like, that money was used to actually buy alcohol or buy pot, or do something that you may not agree with. For other people, if they're making a big mess around the house, after a night out, cleaning up after them. I think this next one is about time, thinking about even spending time engaging with them. If someone is, let's say, intoxicated and they're coming home, or they're avoiding the responsibility that maybe they should be doing, spending time with them in that moment could be sending some mixed messages, and that, you're okay with them doing that particular behavior, or offering rides. We've talked about this a little bit, doing favors for them, like, if they're not getting their laundry done and you were taking care of that, yet we expect them to start to take care of their own responsibilities, that could be a little bit tricky. And then also this last bit is not time, but rather reminders about time. So reminders to get up for school, reminders to get up for work. Sometimes that's helpful. And then other times it makes it a little bit harder for people to navigate how to do that, because if things feel too comfortable for too long, there's not a huge motivation to change. For instance, if people were taking care of all of these things for me, I don't know if I would go ahead and try to do some of these things for ourselves, because we all for ourselves calculate a cost benefit analysis. And so if the benefits of the status quo outweigh, the costs of making any change to do things for ourselves, why change? And so we can't force our loved ones to make any change themselves necessarily, but we can think about, well, how can we shift the environment around them to make it more conducive to change? So for ourselves, I want you to think for a moment, and I'm going to put a poll in the chat about what type of unintentional support you may have run into yourselves in terms of offering support to your loved one. Okay, so go ahead, and if you can see this poll, again, some of the options may have been making excuses in the past for someone, providing financial support, cleaning up after them, spending time with them, offering use of your car or offering rides, doing favors or chores at home, giving them reminders when you felt like maybe they could have done this themselves. And so feel free to choose any or all of the ones that may have applied to you or your loved one situation. Okay, yep, and someone's putting in the chat, doing laundry, giving money, making excuses at times, sure. We're only human, and just to reiterate, we've done these things because in the moment, it seems like the best choice at the time. So we can take stock of what we've learned and think about whether or not it makes sense to continue doing some of those things in the future. All right, so I'm going to end the poll and we'll see where we're at. So it looks like the top couple of things are cleaning up after a loved one and giving reminders, followed by things like providing financial support and offering, use of car or rides. All right, thank you so much. So I think that you can all maybe see that there. And then we'll move on so that we can get to our Q&A in just a few minutes. Okay. All right. So when you're thinking about where to shift the needle with allowing natural consequences, you want to first think for yourselves about what type of natural consequences would actually be perceived as negative to your loved one, because it's not going to serve as a motive to change if they don't really care about it. So thinking about which of these domains, or which specific types of consequences would be perceived as negative and also safe would be candidate ones to allow. And then you want to, think about which one you might want to target this week or in the near future. And to set yourself up for success, it can be useful to just kind of assess for yourselves, what are some of the potential challenges when allowing for a natural consequence, and what are some of the potential solutions? So one of the challenges is not actually knowing what to say about this. And so one example about how you can give advance notice about a potential change you might want to make would be something like, I know I've given you extra money when you've asked in the past, so I wanted to give you a heads up that this month I'll be able to cover, X bills, whatever you've decided, and we'll need to stick to that amount. Let me know if you'd like any help with budgeting, and I'd be happy to help. So going back to some of our communication skills, this is being really specific and clear, and then also offering to help, and in some ways taking partial responsibility of like owning up to the fact that, yeah, you've given extra money in the past. And so this can be important because if we are changing the rules, it would be really hard to expect our loved one to know how to play the game if the rules are continuing to change. However, we might get pushed on our boundaries sometimes. So for instance, if it's a ride scenario, someone might ask for a ride, and instead of saying like, okay, I'll give you a ride, to the dispensary again, but this isn't the last time, we can say, so long as you've had a conversation in advance, we've talked about how I don't feel comfortable bringing you to the dispensary, so I'm not going to be able to give you a ride there. And this is something that happens to families sometimes. And in this case, we're not choosing whether or not that loved one goes to the dispensary. If they really want to, they could bike there, walk there, find another ride, but you don't have to feel like you've contributed in any way to that actually happening. All right, and so consistency is key because again, if the rules are often changing in a way that's really unpredictable, it can be hard. So we want to try to be as consistent as possible to allow for expectations so that our loved ones can make informed decisions for themselves. And then they can truly own whatever the consequences might be. So also just a little note about timeouts from the positive reinforcement topic that we've discussed a couple sessions ago is thinking about, as sort of a natural consequence in some way, if a loved one is using substances or engaging in other healthy behaviors that you don't actually want to reinforce, you would just take a time out from that. So we're not sending mixed messages of giving a reward for, let's say, doing healthy, like something like schoolwork while they're high at the same time, because that could really send mixed messages. And so for how long would you want to take a time out from positive reinforcement? It really depends on the behavior. But for instance, with substance use or avoiding a particular activity, once they start, being sober again or actually engaging in one of those activities that you'd like them to do, try to reward and reinforce that as soon as you can. So we don't ever want to give someone like the silent treatment, for days on end, for instance. We really try to want to be consistent about when we're offering rewards and allowing for consequences. And you can go gradually too. If you feel like, oh gosh, how do I walk back? Providing all the support to my loved one, you don't have to make all the changes overnight. If we're talking about financial support, you can gradually decrease, how much support you may be giving over time, or switching like a bill over into your loved one's name versus all of them, or thinking about, hey, I'm willing to provide this amount of support, but maybe fewer rides over time, or fewer chores or assistance there over time too. And so just to remember before we wrap up this topic, we always still want to support our loved ones' treatment engagement. So if they perhaps need reminders with getting to appointments, we want to be able to help people get there, because engaging in care is an important tool in how people are going to be able to learn and practice and strengthen the skills to take care of themselves. And also, when we allow for natural consequences, just so you're not surprised, sometimes this can lead to a temporary increase in undesired behavior. So someone might use substances a little bit more if they're upset because they are experiencing the negative natural consequence. And usually this is temporary though. And then when you're not sure exactly what boundaries to set, you can discuss them with your loved one or other people in your family, which is especially important from the consistency standpoint, because if you're setting one set of expectations, but another family member is not on the same page, to the extent possible, getting folks to be united about that is great. And then also, it's okay to update expectations as needed. You can try a certain boundary as long as you're clear about it with you and your loved one. And if things change, or your best guess was a little bit off about what was reasonable, it's okay to update that as long as you communicate that with others. And then always keep safety as a top priority. When push comes to shove, if it's not safe to allow a natural consequence, that's okay to step in. And so think for yourself about where you would make that judgment call. All right, so now I am very pleased to introduce our Q&A panel, and we have a number of clinicians from across McLean, so I'll briefly introduce their names, but I'll let them introduce their own roles in just a moment. So we have Lorraine Corso, we have Robin Gay, Shobana Modur, Emily Volpe, and Tamara Welikson. And so I'm going to stop sharing my screen and encourage all of our panelists to share your videos, and you can unmute yourselves. And what I'd like to start off with is first a thank you, for joining us, because I think this is a wonderful opportunity for our audience to learn, some insights about, the programs that we offer at McLean, but then also your take on what you think has been helpful for clients and families that you've worked with in terms of this idea of empowering independence and thinking about how to set some of those healthy boundaries. So first, let's go around and have everyone just share, who you are, the role that you have in the program in which you work, and then we'll kind of go from there. I have a number of questions myself that I can ask, and then for the audience, feel free to put any questions you like in the chat, and we'll get to those as well. So let's see. Could we start with, let's see, Lorraine, would you like to go first?
Sure, I'll introduce myself briefly. I'm a clinical psychologist at McLean. I work primarily in the outpatient department there, seeing individuals weekly, and also seeing their families and working with families of patients who have had mental health issues, a variety of types of mental health issues. I work with an interdisciplinary team in the schizophrenia and bipolar division, which I think is also an important aspect of maintaining health and thinking about our mental health as our full health. And in that role, I provide psychodynamic psychotherapy, psychoeducation, and also some of the more contemporary treatment approaches like cognitive behavioral approaches. I also spend time on the inpatient units at McLean. I provide a group series for the depression and anxiety division, and also work within a psychodynamic frame and building skills with CBT and DBT.
Thank you so much. All right, Robin, would you mind going next?
I'm happy to. Thank you. It's a pleasure to be here. My name is Dr. Robin Gay. I'm a clinical psychologist and I work at Fernside. I'm also the director. Fernside is a treatment center for co-occurring disorders with substance use and another mental health condition. And it's part of our signature recovery program. And I am the director of psychological services there, where I oversee delivery of services, but also do direct patient care and run groups and evidence-based treatments, including CBT, DBT, ACT, all sorts of acronyms, but that are shown to actually really work and be helpful for people with addiction. And I do a lot of extensive work also with families. I've also studied craft, and I'm also the director of the Fernside postdoctoral training program. So very happy to be here. Thank you.
Thanks for being with us. All right, Shobana, would you mind going next?
Yeah. Hi, everyone. My name is Shobana Modur. I'm a clinical social worker / therapist at the McLean On Track Clinic, which is an outpatient clinic for young adults 18 to 30 who have experienced first episode psychosis.
Thank you so much. All right, Emily, would you mind going next?
Sure. So I'm Emily. I'm also a psychologist at Fernside. So I work with individual patients. I also run some of our groups that Robin mentioned. And I also help to lead our family support and psychoeducation group for loved ones of patients at Fernside.
Thank you so much. And last but not least, Tamara.
Thanks, Julie. Hi, everybody. My name is Dr. Tamara Welikson. I am a psychologist and also the Director of Psychological Services for the STAR program at McLean, which stands for the Support, Treatment, and Resilience Program, where we work with people between the ages of 14 to 25 at clinical high risk for developing psychosis. So whether that be individuals that are at genetic high risk due to having an immediate family member with a diagnosis of psychosis or some other risk factors that people are concerned about, then people usually refer them to us, where we provide either symptom monitoring or treatment services. Happy to be here.
Great, thank you so much. Okay, so, I think one of the questions that I wanted to open with was to get your perspective on what you found the clients that you're working with have thought about what it means to be independent and kind of what the goals around that may even look like for the folks that you've worked with.
I'll just jump in here. I actually asked the question today of two wonderful groups on a couple of our inpatient units, and it was exactly what people had said earlier about being able to follow through consistently on self-care. One thing that comes up, I know for most of my patients, is finances. And that sense of being able to regain something that, many of the patients that we see, people that we see that are dealing with mental health issues, have lost something along the way. And there's that sense that regaining it would also increase one's feelings of independence.
I'd like to add too, one thing that family members I think really benefit from is independence of sense of self, well-being, and happiness. And that's one of the foundations of craft too, in that if a loved one can sort of have a divide between their loved one, which is hard to do when their loved one is suffering, but it doesn't as much have an effect on sort of overwhelming their emotional well-being, their social contacts, their connection with work, their connection with activities that they enjoy doing, so that independence is maintained as much as possible is really, really key and healthy, not only for the loved one, but also for the person who suffers from addiction as well, because we know that helping the loved one feel better can also help the loved one communicate in a way that it ends up being more positive, so over the long run.
Yeah, I guess just to add to that, like when I think of like what independence means to a lot of my clients, I do think like the sense of autonomy, like to be able to make decisions for themselves and to discover like what their next steps will be as well. And just a lot of what the other comments made, just like holding a job, getting a job, going back to school, like that's what I consider as independence.
Similar to Shobana, I also really related to what the parents were putting in the chat box. A lot of my clients do want to return back to college. They don't want to live at home with their parents. They do want to get a job or return back to the job that they had before that was keeping them financially secure. And it's usually that the parents' goals do align with the clients' goals that I work with too. It's just figuring out how to get that next step to getting what everybody wants.
I don't have much to add. I like everything that everyone said. I think maybe one thing to add would be, working at a residential program, we set up next steps. And so I think for people to be able to take ownership of what those next steps are, which is not always, fully possible, because it's really important to have provider input and family input. But any way that we can help them to have that autonomy and to feel like they can advocate for their wants and needs as much as possible, and to take ownership of what their recovery plan is going to be. I think that's really important.
Thank you so much. So we have a question that has popped up in the chat, about someone who has a mother who has recently been released from an inpatient program and will join an outpatient program soon. And so the first part of the question was about, if someone is in a daily outpatient program, do they also need a one-on-one therapist as well?
Well, at McLean, we typically use this sort of, I think what we refer to as a step-down process. When you're inpatient in the hospital, usually there is a plan for what you will receive after the hospitalization that will help you keep the progress you've made. And that is sometimes a day program, which would be daily outpatient groups or individual sessions. That's usually daily, meaning Monday through Friday. Those usually run about 2 weeks. And then after that, the next step down would be to individual therapy. And that would typically be someone would see a therapist, either in our outpatient department or in the community, and also have someone separately who's managing medication if the person is using that as a treatment. And that would typically be a little bit less, but the therapy is often weekly, one time a week, 50 minutes, 50-minute sessions. And sometimes that's run as a short-term approach and sometimes as a long-term, depending on the needs of the patient.
Thank you so much. And so another part of this question that I think might apply to a lot of families is this idea of, having trouble setting boundaries, especially if someone is in a higher level of care. In this case, the mother is also supported by the mother's husband, but how can, this daughter or other family member, take space without making their loved one feel like they don't care? Because I think that's one of the challenges that we didn't expressly talk about in the presentation yet.
I think partly it's really the person who has addiction really taking responsibility for their own recovery, and family members so much need a break often and to really be able to regroup and take care of themselves. And often their own needs have been put on the back burner for a long time. So, and I think it can be framed in terms of treatment, the party is really sort of regrouping and doing what's best for them in a loving and supportive way. And taking care of the family's needs is part of overall helping the entire system. And so if it can be expressed that way, I think it can be helpful. And also just allowing the person to benefit from fully engaging in treatment. And sometimes there needs to be, sometimes people benefit from a slight break to have that full focus on treatment. And then family involvement is, of course, very, very important. But sometimes, like for inside the first week, again, we ask that they don't go off site with family members, and so that they really can feel that they're engaging in the treatment, they feel comfortable in the environment and the milieu and really participate fully. And then second week, of course, is different. So
I might just add, I really like how you can already kind of anticipate what her response is going to be if you do try to pull back. So including that validation when you communicate with her what the change that you're going to make. I think there's often a big disconnect between the intention I have with a behavior and then how that behavior is perceived. And so just talking about that in an ongoing basis can be really helpful. So just validating how she might be feeling if you're setting more of a boundary and getting some distance, and also not letting that, not letting that ultimately, affect what the boundary is that you're setting, and just clarifying that your intention is not that it's not that you don't care. You're just, you can explain why you're doing that, and just continuing to check in on that, I think can be helpful.
Other thoughts that folks would care to share about that?
I'll add to from the outpatient perspective. Oftentimes when family members are concerned about taking those boundaries, we do offer sometimes family therapy as well, where we can come to decisions together. Where if a family member does want to create a boundary, oftentimes the boundary is to help the loved one make their goal happen. So if there is an agreement on what the goal is and both can problem solve together, both the parents and the client, if they can problem solve together, hey, okay, just to pick a random goal, if the goal is that somebody wants to brush their teeth independently without their parents giving them a reminder or something like that, then it's okay, parent, I'm going to take a step back from doing this. Is this okay with you, loved one? What does that goal look like? How do we create this boundary together? What is something that we're all in agreement on? And then really taking the plan from there. So that way the guilt doesn't really have to be there as much because it's an agreed upon plan that everybody created together. And then weekly following up with a therapist, such as my role is as a family therapist, sometimes weekly following up. Okay, how did the plan go? Let's figure out what happened, what didn't happen. How do we modify this so that way it's something that can actually happen this week? Okay, that's great. So I feel like sometimes family therapy could be helpful with that too. So that way somebody else is involved in the planning process.
Yeah.
Thank you. I think that's an important point and certainly speaks to how we were touching on it earlier, this idea of collaborative conversations about boundaries. That way people don't feel like something is being done to them, and rather they're equal partners in the process. And honestly, it can take the pressure off of family members some way in thinking about like, oh, I don't have to come up with exactly what this boundary is, though it is useful to come into those conversations knowing what your personal preferences or limits might be. So another question in the chat was about someone who has a son with delusional disorder, is living alone and being supported by the family financially. The son does not believe that he's sick though, so how do we help him with boundaries when that insight might not be there, yet there is this, financial independence or kind of question about how to reach that?
Even, oh, sorry, go for it. Thanks, Lorraine. So even though somebody might be experiencing, so sometimes when people don't recognize that they're sick and they might be experiencing psychosis, they have a symptom called anagnosia, which is not recognizing that they are ill, even though the symptoms are present. So that I hear all the time as a provider, which is really difficult. Oftentimes, even though people might be having that experience, they usually do have some kind of goal. So if you can try to figure out what that goal or what is it that they do want, and still working with the person where they're at to figure out how to create certain boundaries with them, even though they might be sick, even though they might be having symptoms, they're still somebody that you can work with and find common ground with to figure out how to achieve those goals. So still involving your loved one in the conversation to figure out how to make that goal happen, I would still recommend doing, even if they don't realize that the illness is present. Lorraine, I think I cut you off. What
No,
were you
that's fine. That was a great response. And I think I would just add to it that with delusional disorder, it's often the case that the person suffering doesn't see the need for help in the same way that others might. And sometimes in those situations, it's so important to go back to what you actually said earlier, Tamara, that family therapy can be key. And also seeking support from case management services, other kinds of wraparound services that might help that person attain some independence. The person mentioned that there was a financial responsibility right now that the family is taking, and most likely that won't last forever. So planning alongside with case management and legal services that can help with that as well.
I'd like to add, and I think everything people are saying is really great. One other thing to consider is sometimes there's another way to get them into treatment, which is considering another problem that they themselves identify. So even though substance use may be the main issue that you really want to focus on, it could be that they're suffering from a lack of social connectedness, or they're suffering from a lack of ability to sort of achieve certain other goals. And so if you can use those things as a way of an entry into treatment, then the other goals, once they're in treatment, have a better chance of being addressed by the therapy team or therapists that they're working with.
Just to quickly add, in working like with some families who have a loved one who has agnosia, like not believing, like just lack of insight into their own mental illness, I do like to offer just different resources to family members. Like, for instance, there is a book called "I'm Not Sick, I Don't Need Help" that I believe many of us clinicians are very familiar with. So I do like to offer those resources to families for further help.
And the book is free on NAMI's website for those of you that are interested in Shobana's recommendation. And NAMI stands for the National Alliance of Mental Illness, for those of you that may not know the acronym.
Thank you for that recommendation. It's a great book, and also partially informed by craft as well. All right, so one of the questions that had come through the Q&A box was about someone who has a son with paranoid schizophrenia who believes that the CIA is monitoring every move that he makes, which has certainly led to him not leaving the house for a while. And so he's completely dependent on this family member for full care. So how can that person start making him feel independent? So this might be a gradual process kind of situation, but what thoughts do folks have about this case?
Echoing back to what was already said about mutual goal setting and finding a goal that they have and starting is whatever the small, however small that first goal would be, and then building on the second goal and progressive goals over time.
I think adding to what Robin said too, because I totally agree with what she said. Additionally, meeting them where they're at emotionally. So if anybody can think of how scary it must be for the FBI or the CIA to be after you, that sounds scary. So getting on an emotional level with your family member, saying, hey, it must be scary to think that the CIA is after you all the time. Prior to this, before the CIA was after you, what did your life look like? What were some of the things that you were doing that made you happy? And seeing if there are any of those things that are still there that they were doing before that they want to do again. And that could potentially give you a goal to work on together as well. Like, how do we make life less scary to make those possibilities happen?
Yeah, I think that's a really good piece of advice too, so when we may not agree with the beliefs that a loved one may have, whether it be around psychosis or substance use, instead of feeling like we're getting into a tug of war fight about who's correct or right or wrong per se, we can shift from what I say kind of like the content to the experience, which is kind of that emotional piece that Tamara was alluding to. And so we have another question that had come up in the chat. So let's see, someone was asking a bit about a situation where they didn't like being spoken to a certain way, by their loved one. And so in response to that had said, okay, well, I'm going to leave. And the person said that they thought maybe they worded it in a less effective way, because now he says, okay, leave then. And at the same time, this family member did leave, and later, the loved one had sent a message kind of asking where they were. So what thoughts do folks have about, whether this approach, did make sense, or what purpose that still may have served perhaps in setting that type of boundary of leaving?
I would like to say that if it's the person with addiction or anyone's treating or saying something that's inappropriate and that hurts your feelings, it is 100% okay to say, you know what, I need to take a step back and go for a walk, and I'm going to come back and we'll talk later. Protecting your own boundaries and your own emotional well-being is very important. And it's also something that models appropriate and good, healthy communication and behavior.
Yeah, I'll echo that. I really like that you said, this is something that I'm not willing to kind of sit with. You're not saying you can't talk to me that way or you can't do this. You're kind of keeping it, I'm not willing to sit in this conversation. One thing which maybe this person tried, but sometimes it's helpful, maybe not in that moment, but if you come to revisit the conversation, to give them specifics, to say, these are the specific behaviors that I'm not willing to sit in a conversation with. If someone raises their voice, if someone uses certain language, you can kind of give specifics. That way, at least you've let them know, okay, in the future, I'm going to be on the lookout for these. And these are my signs that I need to disengage.
I think it goes back to what Dr. McCarthy, you had presented earlier about consistency in those messages. And so if that person was continuing to text or say things that are inappropriate, to continue to have that type of self-care and modeling, I think that's really to the point. The unintentional support that was brought up earlier, sometimes when we go back on something that we knew was right for us when we're setting a boundary, when we go back on it, it's sometimes one of those sort of unintentional supports. We're trying to connect and we don't want to lose the relationship, but to remember as best as possible, and I know it's difficult to do, to remain consistent, to go back to those parameters that were set up earlier in previous conversations when everybody was calm, and to keep repeating that that's what you're doing.
Right. I think that that's useful. And for folks who hadn't made our first webinar on communication, we kind of talk about the importance of having conversations that you might want to initiate with a loved one at times when you all are feeling your best, actually, so I really love these suggestions about trying to talk about these issues perhaps at a time when people are feeling more calm or are in decent moods, so that, instead of saying, here's what I don't want, you can have an opportunity to share what you would like, and also clearly set the expectations like, hey, I actually really love spending time with you. And also it does hurt my feelings when you say X, Y, or Z to me. And so if that happens next time, just know, for myself, I am going to take that space, and I'd be happy to reconnect when we're both feeling in a more calm space. And so it's okay to have those things. And I'm wondering if part of the question had come from this idea of, is the loved one perceiving the family member taking space as a negative natural consequence? In this case, they may not, and that's okay. Because I think to Robin, your point about taking care of oneself, this is 100%, important for self-care in protecting one's own healthy boundaries. Because I think sometimes family members wonder, well, when does it make sense to set a boundary? And a couple rules of thumb that I have are, whenever you're feeling like things might be somewhat unfair, or you feel like you're kind of bending over backwards, or feeling like you're getting walked over a little bit, that might be a time, or feeling some level of resentment per se about what's going on with a loved one. And so to the extent that you can find where you have control and where you can make choices that make sense for yourself, even if that is taking space, I completely agree with what others have said about that really being an appropriate move. Okay, so we have another question that had come up. So for this parent, they're asking about a loved one who's a young adult who has jobs, multiple perhaps short term, so has their own money, and wants to travel remotely, like to the Amazon rainforest per se, alone. I think the concern is about the fact that this loved one has bipolar disorder and also cannabis use disorder. And so for this family member, it seems difficult to kind of contemplate how to reasonably support, or encourage perhaps travel to less remote places that maybe aren't as appealing. And the young person is also working with a treatment team. So any advice for this family member about how to strike this balance when their loved one actually has a decent level of independence already, though there are concerns about how that's operating?
If it could be addressed also in a session, whether it's a family session, or I would say a session with different family members. I like the idea, if they're okay with it, showing their independence by, if they can do a shorter trip that's more local, if they're doing things that are healthy and showing good judgment, taking their medications as prescribed, engaging in treatment. And if short trip goes well, then maybe talking about a longer trip, but also doing a family session on what are the concerns and what are and validate those concerns and develop a plan. So, yeah.
Yeah, I agree with Robin, especially if the daughter has a treatment team that she's working with, like an active treatment team, psychiatrist, therapist. I think it's a good idea to have a family meeting about that.
That's also one of those areas of independence. Sometimes the person who is receiving the treatment doesn't want their family involved in the ongoing relationship with the therapist. But I would say, after my years of experience with psychotic-based disorders, that overall, when people allow their family member to have some access to the therapist, it does work best. And this would, I agree, would be one of those times to ask the person if we could have a family meeting before you go on that trip. And also to look at, and even to express that some of one's reaction might be coming from love and some might be coming from fear. And I think, as most parents know, love and fear are very close when dealing with a child who's making decisions that, whether they're adults or young children that are making decisions that put them potentially at risk. So yeah, I agree that the family sessions could be really helpful here in fostering a openness in the therapy where the family can come in intermittently to talk about things like this. I think is really essential.
Yeah, I might add, I think all of that is so helpful. And I think I might add to, maybe to frame, if we're talking about kind of safety planning or having a plan, if this person's going to take this trip, to maybe frame that as, effective and responsible independence involves coming up with a reasonable safety plan and to let people know what that is. So to frame that as something that maybe you can get them on board with. Yeah, so sometimes that's maybe, it doesn't feel like enough, but sometimes maybe that's all we can do.
And this might also kind of speak to one of the communication skills that we discussed about offering to help where it's appropriate. Sometimes in a situation like this, a loved one may or may not actually want help in terms of figuring out the details of the trip, or to offer, to come up with a completely comprehensive plan, let's say. And so to the extent that a family member might be concerned about it, it's okay to offer help, and if that person accepts that, great, you can help them come up with a plan and whatnot. And if not, and they are in a position to continue making their own decisions, you can also be there, if this person is in a position to ask for help in the moment or on one of those trips, and think for yourself, well, how much help are you willing to give? For instance, I've worked with other families where people have had loved ones traveling abroad to other countries, and they're not sure exactly how it's going to turn out, and so one of these individuals, might think about, okay, if my loved one has an issue with getting their medication or, something like that abroad, what are you willing to do? Are you, if your loved one calls to talk to you about that, are they talking to vent, or are they even asking for your help to begin with? And so also thinking about, right, what are the concerns, and then what kind of help your loved one may or may not be looking for, and how much help you're willing to give, whether it be giving guidance so that they could figure out how to get that medication themselves, or if you would want to actually, try to arrange for that medication to be sent for them. You can think about what makes sense based on your particular situation. Yeah. And so I think in all of this, there is some element of risk of not knowing how things are going to turn out. And so being able to sit with some level of uncertainty or risk allows, sure, both for things to potentially be somewhat challenging, but it also allows for things to go better than we had ever hoped to. And so one question that I'd ask the panel now is, what have the clients that you worked with personally found helpful when pursuing or building their own independence?
I'll start. One thing that is helpful in our family meetings is that we develop a contract if the person wants to, and the contract is that they agree to do certain things, they get more independence, and the family agrees to either do this X support or not support. And if they're both on board with it, it can be a really good exercise so that both parties feel comfortable with the level of independence that they're agreeing to. And it may be you allow for some natural consequences. If you can't pay your bills, maybe the family says, we won't continue to support you and you may have to find another place to live. Or maybe they say that if you get a job by this amount of time, we will support you. It's really, the contracts can be absolutely individualized to what all parties agree with. But the contract itself can help the loved one feel that they're achieving something that they want because they participate in the contract, and they can also say, no, I don't agree to that.
I agree with what Robin said. Sometimes absolutely contracts can be helpful and can be created in family therapy. I'll also add, based on Julie, the craft presentation with positive reinforcement, I see a huge change in the people that I work with when parents start to positively reinforce the behaviors that they want to see and the behaviors that are good for their family members to have. A lot of times I hear kind of the opposite from my clients, where parents will be saying, you're not getting up, you're not getting out of bed, you're not brushing your teeth, you're not showering, you're not in school, you should be in school. And oftentimes that makes them feel defeated and like failures, and they don't want to get up, they don't want to brush their teeth, they don't want to shower, which is exactly not what the parents usually intend to do or want to do. They just want to help. And sometimes it unfortunately does the opposite. However, when a parent changes that and says, oh, that's awesome, you got up today, you brushed your teeth, oh, you took out the trash, it's amazing. Those little things can go so far in helping our clients make changes. So family involvement, since you're all with the family, with our clients 24/7 and we're not, that does so much for our work with your kids, and for your family members too. So, yeah.
I think for my individual patients that I've worked with over the years, something that helps with their own sense of independence is being able to recognize their stress tolerance. So sometimes, if there's a goal, returning to school, returning to work, having a relationship, moving out of the house, those goals don't always happen in a linear way. It's often a long process. And so developing that concept of recognizing what my stress tolerance is, what do I need for myself to manage my stress? And I think for parents to remember that while stress might trigger symptoms in their loved one, an episode of symptoms doesn't necessarily mean that there will be more stressors that follow. I think helping the family recognize that sometimes their own trauma, like Dr. McCarthy showed us on that screen, and their history with worry about their loved one, that sometimes leads to a catastrophizing response. So to try to help the family see that validating and catching the catastrophizing before they act on it, and for the person themselves to recognize their own stress tolerance and what they need to manage it better.
Great, thank you so much. And one person from the audience was asking if there is any online information perhaps to help with, one of these family contracts. Any sense of resources there or recommendations? And if not, that's something that we could think about, for future webinars.
I would look to see if NAMI has contracts. I don't know that they do. I know we have some contracts as a template that we use. And there might be some in the Family Guide to Treatment written by Dr. Hilary Connery. Maybe I'd look there. Maybe we can get back to them on that answer. So.
Sounds good. Thank you. And also to put in a plug for one of our future webinars, though it may not quote be a contract per se, the Wellness Recovery Action Plan, or WRAP, can often set some expectations for people about identifying their own needs and how they would like their family members to be involved, should they need assistance, and can potentially, cover some of those topics as well. All right. So thank you so much to all of our panelists for sharing your wonderful insights. And before we wrap up for tonight, I'm just going to share some resources on the screen and in the chat about additional support that might be of interest to folks for those of you who are associated with McLean. So we have a number of family support groups, some led by Shobana Modur as well, and that really span, general support that people might be looking for first episode psychosis, addiction. There are peer and family support services, things specific to interventions like ECT, for instance, loved ones who are experiencing dementia. And then also as a specific event coming up, we have our McLean on Track 10th semi-annual Sharing Recovery Night, led by one of our peer specialists with lived experience with psychosis, Steve Fideli. And so this is a great chance for anyone who's interested in learning more about psychosis recovery specifically. And our next family webinar will be Thursday, September 14th, 2023, 5 to 6:30 p.m. And we'll be talking a bit more about problem-solving solutions. And so, if people have lingering questions about, well, how do I do this, allowing for natural consequences, or what kind of boundaries, are making the most sense for my family to set, please come with questions about problems that you might be interested in solving, or feel free to shoot me an email if you like, with any questions that you might have in advance. And so last but not least, we also encourage folks to complete that feedback survey. And I just put the link again in the chat. And I'd like to acknowledge, all the people who have certainly made our Crafting Support Project webinar series and the research possible. And thank you. Here is my contact information if anyone needs it. And let's see, I think that's pretty much it. And the other thing that I'll just say is I'll put in the chat a Word document of the McLean resources that I had mentioned for anyone who didn't have a chance to screen grab that. So let me do that. And then I think we will be, oops, I may not be able to add that attachment, I apologize. But we'll have that available for people if you need it. So thank you so much again for joining us tonight, and we will see you next month. Take care, bye.